Happy New Year, and welcome to Health Plus Weekly. I'm Dr. John Podkowa, and I'm joined by my co-host, Peter Kohana. And we also like to welcome Hannah Raymond, nurse practitioner for Southcoast Physicians Group, to our conversation tonight. We hope everyone had a great holiday and a wonderful new year, and we're looking forward to a great year upcoming. Tonight's show, we're going to talk about, in the theme for the month of January is about improving your health and New Year's resolutions and how we can make changes in our lives to get healthier, stay healthy, and prevent some diseases. We have a big storm kind of bearing down on us tonight in the greater New Bedford area that we're going to maybe talk about in terms of some precautions in shoveling snow. As always, we encourage you to send your questions in via Facebook or the anonymous telephone number that you can text messages in if you don't want to associate your name with the number.
And that number's on the screen, and just for those who haven't seen it before, it's 508-717 8948, excuse me. So yeah, please text us any questions. Again, those are all fully anonymous.
We want to thank everyone for tuning in the past. We want to just encourage people to, share the show, tell people about the show, so that we can spread as much information as possible to the communities. Peter, Hannah, any good New Year's resolutions that you guys are working on so far? Or?
So, working on them. A New Year's resolution is supposed to start on New Year's?
I don't think so. I don't think you have to have that pressure.
The whole month.
So, I want to get back in the gym, but everyone else is in the gym now because that's everyone's New Year's resolution. Yep. is to maybe get back in shape or lose a little bit of weight. And so I got to wait for that initial surge to die down a little bit before I get in there. And
do you belong to a gym now?
I do. I don't get into it as often as I should, but hopefully that will change with the new year.
Absolutely. Hannah?
Same every year.
I am having success with my new beard, though, that I'm growing. I did start.
Yeah, I like it.
I did start growing that on New Year's, and that's coming in pretty well. So I guess I am accomplishing something so far. Yes.
I looked up in preparation for the show the most common New Year's resolutions. So you guys are on point for the number one: exercise more. 38% of people polled in the articles that I read, that was the number one resolution. Next behind it was losing weight. 33% people want to lose weight for the new year. And the third one is eating healthy. 32% want to do that. I was surprised that actually quitting smoking was the 9th. It was actually at the bottom of the New Year's resolution, which I think is maybe really positive that not many people are smoking anymore. Or on the negative side, maybe people really like it and don't want to quit.
Or how difficult it is to actually quit smoking too.
Yeah. And I know this month we're going to have some members of our physical therapy team on talking about exercise and kind of do's and don'ts with that. But, patients come in a lot and ask me about exercise, and I think people underestimate how little exercise you have to do to start making a significant benefit in your overall health. And I tell people just beginning to walk 10 to 20 minutes a day and try to get up to about, if you can get up to 30 minutes most days of the week, can make a significant impact into your overall health and losing weight and actually feeling better. I'm not sure if you feel that way when you started working out before. It's amazing how just once you get started.
Well, it's hard to. I have an all or nothing attitude with a lot of things I do, and unfortunately that applies to the gym as well. So I know that I could just maybe do some push-ups, a couple things at home, 10, 15 minutes in would be great, but I have a hard time doing that. It's like I need to get into the gym. I need to spend that hour working out hard. So I'm trying to make that adjustment to not be that all or nothing with it. But just to your point, we had Dan O'Brien, who was one of our weight surgery patients, and he's lost over 160 pounds since he got the weight loss surgery. And I asked him, how often are you in the gym? How often are you working out? He said, I hardly ever go into the gym. I just get out and I walk around my block and I make sure I get 10,000 steps a day and I just eating healthy and that's that can really be all it takes as long as you. I've seen the statistic before that it's 80% diet and 20% exercise.
Yes.
So as long as you're eating right and you're getting a little bit of exercise, that's not too hard.
No.
But it can be.
I think I'm not sure when you see patients, patients do that all or none in a way and beat themselves up.
Right.
And I try to tell patients, like, even like a 10% drop in your weight, wherever you are, actually conveys a significant improvement in your overall health, blood pressure, reducing, cardiovascular risks. So that's a great way to start, for patients.
So we've got a couple questions in already.
Already?
If you wanna start tackling those, or if we want to talk a little bit more about New Year's resolutions.
Why don't we? No, if people are writing in, let's open it up.
So actually a couple comments here from a friend of yours I know, Ian Abreu, city councilor.
Congratulations, Ian, on re-election.
Yeah, absolutely.
Just sworn in.
He just wanted to reach out and say hello and that you are the best. And we got a couple other well wishes from the Farias family, and a couple happy New Years from Eva. So thank you to everyone who's reaching out and with all of the kind words. Our first question is kind of a general one. It comes from Ashley. She said she's had chest pains for the last few days. Should she be concerned?
So in general, we get concerned with chest pains. I think as we've learned watching this show, we all need a little bit more information before we can kind of properly assess how serious it is. But I would say that if she's concerned at all, that she should probably seek some medical attention.
Yeah, and the problem, with chest pain, with kind of a host of other complaints is a variety of things can cause it. Some really bad. You think about heart attack, aortic, dissections and problems, blood clots in the lungs, and then a variety of non-serious things can cause chest pain as well. Inflammation of the cartilage and the bones, heartburn, gallbladder disease, pulled muscle. But our job as doctors in assessing this is you want to rule out the bad things first, and then you can address maybe the not so urgent things. So, depending on Ash's age and risk factors, I would address getting that checked out sooner rather than later.
The next question is from Joanne. She, like so many other people, her resolution is to lose weight and to live a healthier lifestyle. However, she doesn't like exercising, so she's really focusing on her nutrition. She's meeting with a nutritionist to get a diet plan, and she wants to start meal prepping. She's asking if we have any suggestions, and I know, Dr. Podkowa, we've tackled this subject in the past.
Yeah.
I know you're a big believer in a plant-based diet. If you just talk a little bit about what you think would help.
I've mentioned this before in the past, but there are these books written by Dan Buettner called The Blue Zones, and talking about the people who live the longest and healthiest in the world, and then kind of what are their habits and what do they do. And so it's a great question, and thank you for asking it. And so going through the 9 is, number one is they move. So you may not like exercise, and you don't have to formally go to a gym or start, P90X in your basement. But if you just start to move around more than you currently are, whether it's parking your car in the back of the parking lot and walking a bit further, whether it's taking the stairs at work, if that's involved in your life, whether it's, doing an extra lap around the grocery store when you're going to do the groceries. Number one, because people who live long and healthy, they move on a regular basis. 2, the 80% rule, which a lot of these cultures they follow, is that they stop eating when they are, 80% full. And by doing that, they stay thin. And it's estimated if Americans did that, if we stopped eating before we were full, we could lose up to 17 pounds a year. So it's interesting in talking to my patients, and I've realized about this, people stress and worry over what should I do and not do. And I've started to just try to tell them, just eat less. Don't worry so much about what you should and shouldn't be eating. Just start eating less than you are, and we are taught, so many of us from a young age, that not to waste food, that we should finish our plates, and there is food shortages all across the world, but we often consume too much in this country. So leave stuff on your plate, save it for the next day. I have people who have lost a lot of weight, and if they go out to eat, they immediately take half and right off their plate from the beginning, or get it to go right from the beginning and eat half the portion.
We've had dietitians on in the past, or at least I've worked with in the past on other things, that has said that historically the size of the plates that we get at restaurants has almost doubled. That it's 30 years ago, if you went to a restaurant, the actual plate size was smaller, and therefore the amount of food on it was less. and now that's almost doubled. So the amount of food that we get when we go to a restaurant is just way more than we actually need.
My grandparents, I grew up, my grandparents lived in the apartment below my parents, and when I go home to visit my mom and dad, I was just there, over Thanksgiving. It was down in the apartment, they both passed away, and I was down in the apartment getting something, and it was so funny, I was going through their cabinets to look something, and the glasses, like my grandfather's orange juice glass was, this big, and his coffee cup just seemed almost miniature compared to the the size and the scope of what we have now. The other things for changing your life and improving your health, which these communities do, is actually whether it's called the right tribe or the right community, but surrounding yourself by people who are motivated to do similar kind of habits and changing is really powerful. So.
No, I was just going to talk a little bit about her, considering meal prep and meal planning and stuff. And when you think about the end of a hard day, if you go home and you're tired, the first thing you reach for is a bag of chips or something. Maybe when you're less structured in your diet, you make poor choices more easily. So if food prep is the good strategy that you need to use for making a healthy choice kind of throughout the whole week, it's spending that extra time on a Sunday before the week starts and planning out each meal and kind of making it easier to make easier choices and better choices throughout the week.
And a great way to save money too.
Save money too, yeah.
So the next question is from Lucy, who is asking for her 75-year-old mother who has sciatic pain.
Mm-hmm.
Any recommendations on how to relieve it? It says it starts at her back, shoots down her leg.
And without knowing the full details of her mom and her kind of other health issues, I think you could start conservatively. I'm not sure if she's seen her primary care doctor or first to kind of exclude an evaluation of some more serious things that are causing it, but some simple things that possibly massage therapy actually can be very effective in terms of kind of loosening up the muscles. I actually am a big proponent of chiropractors. I work with a lot of great chiropractors in the area who help people with back pain, physical therapy.
Stretching. Simple stretching at home can be helpful too.
So why we bring Hannah? Yes.
Yeah.
Common sense, stretching. Very good.
Your
Thank you,
tears
Hannah.
stretching.
Yeah.
How would you recommend a 75-year-old? What kind of stretches would you recommend to them?
Again, it depends on overall health, but just not, kind of listening to your body in terms of what's good. But you're just trying to stretch out the lower back and kind of engage the core and strengthen some muscles there, but also just so kind of some toe touches or sitting on the ground, nothing that's going to cause you to topple over quickly, but just listening to your body.
We have an amazing physical therapy department at Southcoast. We're really lucky, and again, they're going to come on later on, but that's one of the reasons why people see physical therapists. They kind of evaluate your pain, and so they're great for back pain as well, and can teach you which stretches are best for you, when you should do them. So absolutely.
And a lot of times it doesn't take 100 visits with a physical therapist. A lot of times they just give you the skills and the tools that you can use at home if you're able to kind of structure it yourself.
Maggie's asking about ringing in her ears. She's had it now for about a year, and it's driving her crazy. Any insight into that?
So this kind of harps back to the chest pain, scenario. If it's both ears, it would, kind of important to parse out some of the more serious causes of ringing in your ears. Is it pulsing? Is it constant? Is it, what's the pitch? Any other related symptoms? But generally, kind of after all of the scary things have been ruled out, an evaluation by an ENT doctor, kind of a hearing evaluation, is a good next place to go. Do you have any other recommendations?
No, I think the most common cause
troublesome.
in adults often is hearing loss is driving the ringing. But like Hannah alluded to, you have to do a good, thorough history, because there can be enlarged blood vessels that could cause it, possibly some other more serious causes. So that is a symptom that you should definitely be looked at.
Yeah. And recommendation: make an appointment with your primary care doctor.
I think it's a great place to start for us.
Yeah.
We see a lot of ringing in the ears. Absolutely. Sometimes medications can cause it, right?
Yeah. Sometimes just kind of fluid. If you have sinus congestion and there's a little bit of extra pressure back there, people will complain of ringing in the ears, and that's more of a simple fix. But.
Stress and anxiety, it's a major symptom actually of anxiety, can be, or is ringing in the ears. So we see it a lot, and it's, I think it's tackleable. You just have to I would start with a primary care doctor if she has one, or ENT.
And generally, for all these questions, trust your body, right? If you feel like something's wrong, go see your doctor. It can't hurt, right? I mean, I can imagine you ever get upset if someone comes in and they're worried about something and it's not actually something, and you got to send them home with a clean bill of health. That's not necessarily a bad thing for anyone.
Yes, yeah. I think solving problems when they're small problems is exponentially better than when they kind of escalate.
And just know that, I personally put a lot of weight in when somebody tells you, I just don't feel right.
Yeah.
So I think, if you can't specifically put your finger on it, but just knowing that you need to kind of keep your antennas up too. So people should feel welcome to kind of bring, as non-specific things if it's bothering them.
Speaking of not letting something kind of move to the next stage and get progressively worse, Michelle is asking, someone in her family has had pneumonia 3 times and feels like they're on the verge of number 4, chest discomfort, pain, night sweats, coughing. Are there any home remedies that you would recommend, over-the-counter medicines? Generally, what would you tell this person to do?
Well, if it's a bacterial pneumonia, it's unlikely that it's going to resolve without treatment, and it can certainly cause some serious complications if it's untreated. So, I would, again, recommend that after kind of going through the regular home remedies for cough and cold, we do get a bit more concerned with any type of shortness of breath and fever and chills and just kind of feeling worse, especially when it's accompanied by a cough. That they should probably get checked out if it is if it is pneumonia, if there's concern for that. But in general, kind of a viral cough. There's some new information that dark chocolate can be. One of the other nurse practitioners that works with us recommends a little square of Dove chocolate if you just have kind of a lingering cough, and has found it kind of anecdotally pretty effective. Good hydration. You have to be kind of careful with over-the-counter cough syrups depending on your other medical issues, but generally Mucinex is pretty safe kind of to help move along some of the stuff in your lungs.
I would caution right now, and we were going to mention also, we're currently kind of moving into or in influenza season or flu season, and we are experiencing high levels of flu activity. The Center for Disease Control has put out several warnings to doctors in the community to be on the illness for influenza. So influenza is a virus. It's a winter virus. It enters our body through our lungs, and one of the most common side effects or kind of ramifications of flu can be pneumonia, and so you have to take it seriously. So influenza-like illnesses are fever, cough, runny eyes, and if those are your symptoms, you're having fevers or chills, you should definitely be evaluated, because we know if you're seen within the first 48 hours of your flu symptoms and you get on the right medications, it actually shortens your length of illness, helps you prevent from spreading it to other people, and decreases complications. So now that we're in flu season, people should have a healthy respect for coughs, not feeling well, because it can lead to something serious. And of course, we recommend the flu vaccine. Even though this year there's some debate about how effective it is, it still helps prevent some of the illness associated with flu, and it's safe.
And I can tell you that influenza is very real right now in this region. We have seen 80 plus cases so far, and about 60 of them have come in the last 2 weeks between our 3 hospitals. So it's peaking here now. I shouldn't say peaking, it's elevating now. I imagine our normal peak is around February and March, so we're a little bit ahead of schedule right now, but it is here. So
what's fascinating with influenza is it's a winter virus, and so we can predict how the season's going to be based on our opposite hemisphere. So in Australia, or the southern hemisphere, their winter is opposite our summer, and so they had a very heavy flu season, and they had a very heavy flu season of a type of strain of the flu that was not very well covered with the vaccine, that causes some pretty significant illness. So what we know as people travel in planes and those viruses move here, this is why there's so much caution about this year's flu season, that to be on the lookout for it. So absolutely.
Garrett is asking about functional medicine. Is that something that either of you?
Not too familiar with it, no.
No, maybe maybe
what-
there's another term or another
Yeah.
name for it. But if you could
Yeah,
elaborate a bit
Gary.
more.
Yeah, if you don't mind, she references Dr. Mark Hyman. But if you could add a little bit more information, Gary, about what exactly your question for functional medicine, maybe a little more info. We can revisit it later on in the show. I'm sorry, I might butcher this name, but it looks like it's Glynis. Glynis is asking about she's been having high blood pressure readings recently. Increase in blood pressure and a headache. What is the best way to bring it down quickly at any moment? Thinking about eating better, low sodium foods.
Good question. With all these questions, there's never quite a simple answer. You have to actually be careful with blood pressure. You don't want to drop it too quickly because that can cause problems on their own. But the second part of our question is lifestyle choices you can make to help lower your blood pressure. Without a doubt, watching the salt or sodium in your diet for sure lowers blood pressure.
Weight loss is also another, not a quick fix, but certainly one of the top things you can do to decrease your blood pressure.
When I talk about sodium or salt in people's diets, not many, many people think I don't use that much salt because I don't put that much table salt in my food. They're not pouring their salt, but hidden places of salt that some people may not realize: canned soups or processed foods, super heavy in sodium. They, in order to make things preserved, they're stripped of their potassium and actually load it with sodium. And it's just cruel and ironic, but foods rich in potassium naturally lower blood pressure, and foods low in sodium lower blood pressure as well. So in processed foods, we get the opposite. They get stripped of their potassium, load it with sodium, and they can cause it. So any frozen foods, canned soups, actually some sodas can have a lot of sodium, which a lot of people don't realize as well.
And also like bread and crackers too is kind of a hidden source of a lot of high sodium foods.
Chinese food, usually out to eat in general, often. Processed meats have a lot of it as well. So sometimes I'll see patients in the office and their blood pressure is elevated and hasn't been before, and I'll ask them all the time like what they had to eat the day before. And it's really interesting. I ate out. I had tomato soup and I had a grilled cheese. And, I had some Chinese food. So the simplest way is watching the salt. Alcohol and is also can raise blood pressure.
Smoking, decreasing, not smoking.
So we have a nice message here from Dr. Michael Rocha, who a lot of us know from the community's cardiologist here in the Bedford region. I'm surprised, Dr. Rocha. We'd actually like to invite you to come on the show. We've been meaning to reach out to you to see if you might be available, because you do have this event coming up that I know I've been hearing a lot about, Live Well, New Bedford. I believe it's the second year that they'll be doing this. We're coordinating a lot of the assets around the area to do at least a one-day blood pressure reading. I know last year the goal was to get to 1,000. I'm not sure if that might be similar again this year, but we'd love to have you on sometime before then, talk a little bit about the event, and also to have you answer some questions as well about heart care and cardiac care sometime in the month of February, which is Heart Month. I know a lot of people.
Yeah, Mike, we would love to have you on. I personally would like to say that, what a tremendous influence you've been on my practice. Your, education and emphasis on wellness and just has been, I think, just a tremendous influence for our communities, and we're lucky to have you. So we would love to have you on the show, and yeah, absolutely. Thank you for everything you do.
So we have a question from Nicole here that I would love to get to after we take just a quick break. So Josh, if you don't mind rolling video one, we're going to take a quick break here, get some water, and we'll be right back to answer Nicole's question.
People actually come up and they're like, I got to hug you. And it's like, this is the first time in X amount of years I've not been in pain. And we get that feedback every single week. Integrating the nurses, integrating physical therapy, that is all part of the treatment strategy, the treatment algorithm. In a matter of weeks, matter of months, they're now able to have the life that they want to live. And that's really more than medicine.
Welcome back. So our next question is from Nicole. She's 25-year-old, hip and upper thigh pain, just recently started in the last week, getting more frequent, sharp pain, more painful. Occurs when walking, forward, backward, sideways, all the ways really, she says. It's a sharp pain, dulls gradually upon rest. Not a radiating pain, very localized. Possible pinched nerve, she asks. What else could it be?
Well, first of all, thank you for the great history.
Yes.
You should, yeah, absolutely. Hannah, what do you think?
So, upper thigh and hip, was it? I got lost in the history.
Yes, it
Yeah.
was hip, upper thigh.
Hip and upper thigh. So certainly if you think about the hip flexor muscles, kind of anything in the anatomic location. So you think of the bone structure that's there, the muscles that are there, the ligaments that could be involved. Certainly nerves throughout the whole thing. That's more of like a shooting pain generally. And so it could be a whole host of things. Kind of depends on if there was an injury or kind of an activity that started it, to give us a little bit of better direction as to, you know, what's causing it. But, you know, front of the hip, side of the hip, you think of bursitis as well, could be. That's generally kind of with pressure applied right to it where it's painful. But it could be muscle strain kind of.
Yeah, very common muscle strain, especially she's young, whether she's exercising or not. There's kind of be a psoas strain. Some actually, it's not common, but you can see it is what's called a labrum tear. So there's a piece of cartilage that your hip and pelvis kind of articulate around. If that's injured or torn, it can be painful in the upper hip area. Absolutely. So, you know, stretching it, if she's familiar with how to stretch, there's different stretches of stretching the quadriceps out and the hamstrings. Ice is always a great modality to calm down inflammation. People love heat. Heat feels really well. Sometimes heat can increase a little bit of swelling, though, so I tend to err on the side of ice for my patients and stretching it out.
So Maggie is asking if you're taking new patients, and I know that I believe that your panel is currently full. If that's the case, who any doctors that you work with that you would recommend a family member to that you
Unfortunately, my panel is pretty much full right now. It kind of changes and fluxes. People kind of move in and out of my practice. Maggie, thank you for asking. I work with several great doctors in my same building. Dr. Kevin Gendro, who is actually going to be on later on this month, is a family physician who's fantastic. He's accepting new patients, smart, articulate, compassionate.
From Fall River?
From Fall River.
From this area?
Dr. McKinney is in Dartmouth as well. She's accepting new patients. And she is in the Dartmouth area. And if you go to our Peter, what's our website?
Findadoc.com.
Yeah, which is right
on the Southcoast.
Which is right on Southcoast.org. If you go to Southcoast.org, right there at the top of the screen, there is you can search bar. So you can either search by doctor, you can search by specialty, or you can click right on the doctor's tab, and that'll bring you into an even more specific search area where you can really search for anything you'd like by location. Again, by specialty name. So, and actually right there, it'll actually show you on the website if the doctor has availability, and you can start that process through the website. Great. So we've caught up on all the questions. So with the big storm coming, we are inevitably going to be doing a lot of shoveling in the next 24 hours. And so any recommendations on how, folks who are going to get out there, things they should do to prep or while they're shoveling, things they can do? Just, I've seen a lot that heart attack is a major thing that happens when people are shoveling. So how do people stay healthy?
I would say just kind of more of a mechanical issue when shoveling. A lot of back injuries I've seen from shoveling. So just concentrating on not straining, kind of keeping your hips and back square, not trying to lift too much snow at one time. Might take a little longer, be a little colder, but in the end, I think your back will thank you.
Yeah, and so lots of back injuries, but a lot of heart disease. And why? So it is a very strenuous physical activity, and it's also being done in when you're cold and blood vessels are clamped down, and so people who are high risk for heart disease. Whether you may or may not know this, but people who have high blood pressure, people who smoke, people who have diabetes, people who may be overweight, people may be over the age of 50, or if there's a strong family history of heart disease in your family, or if you've already had heart disease yourself. These put you these type of things put you at a higher risk. So your awareness of before even going out and doing that should be high. That's for starters. And just to have a healthy respect for how much physical exertion it takes shoveling snow. I'm not sure if it's supposed to be a dry snow or a wet snow, and that kind of varied as well. So if you're high risk, you may want to think about asking for help. Maybe you shouldn't be doing it. And if you're going to do it, really listen to your body. We're not Rocky. No pain, no gain is not, so if and classic symptoms of heart disease we think of are, left-sided chest pain, maybe arm pain. Those symptoms came initially from people, really studying men. So they're not always the classic symptoms. And then, so women often present with different symptoms. Maybe it's, more jaw pain or shortness of breath, nausea. Diabetic patients often don't get chest pain with their, with their heart symptoms. They maybe get short of breath or they get some nausea. I have people present with tooth pain.
So out of proportion, sweating. And
yes, sweating is very common. The most common symptom other than chest pain is actually shortness of breath. So really significant shortness of breath is a red flag. So just stop and don't push yourself because it can be serious.
And as you referenced, this is a strenuous activity. So just like if you were going to go out and play some pickup basketball, you definitely would stretch out before. And I know that our orthopedic providers who we've talked to in the past about the subject have always said, make sure you stretch before you shovel. It'll help prevent any kind of injuries. You end up, you do it and you're fine, and you go back to the couch and all of a sudden you feel like you pulled a muscle. It's because, just like any other strenuous activity, you got to make sure you prep your body before you go out and do it.
Other things besides heart that you worry about in snow is a fall. I think people underestimate how much a fall can hurt you, especially if you're elderly, above the age of 65. Whether a broken hip can be catastrophic if you slip and fall. So making sure that you don't slip and there's good precautions there. Making sure that someone knows you're outside and actually doing this, because I've had patients who have fallen and no one's known, and that's another risk. So just being kind of aware if something did happen, that someone would check on you and know where you are. So especially
in these frigid temperatures, I know that's a whole other can of worms that you have to worry about this time of year. Is these extremely cold weather, these extreme cold weather that we're dealing with right now, storm or no storm, and that is talking about footwear. We've talked a lot in the past about make sure you get yourself a proper pair of boots that have good tread on them that keep your feet warm. Dress in layers to make sure that you maintain your body heat. Wear a hat, cover you lose a lot of your body heat from your head, and so make sure
changing wet clothing quickly too if you're sweating while you're exerting yourself, kind of getting out of that clothing as soon as possible, especially if you're going to be back out in the cold.
And if you were to fall, I mean, you in this type of temperature, you're not going to last too long. So really make sure that someone's aware that you're out there and is looking out for you. I think that's very important.
Yep.
So let's take one more break, and we will be back to answer some additional questions. Feel free, everyone, to please send your questions along. You can do so in the comment section, or you can text them to us anonymously. That number is 508-717-8948. So you can text those. We will get those directly to us here. We'll be back in 30 seconds.
Teamwork is indispensable. We don't have cardiology and cardiac surgery separated the traditional way.
All these people come together and treat the one patient. It takes that collaborative effort to provide the best care for patients.
That's what makes us different at Southcoast Health.
We're one of the best cardiothoracic surgery programs in all of New England.
That is more than medicine, I would say.
Hi, welcome back to Health Plus Weekly. If you thank you for sticking with us, or if you're new, thank you for joining us. It's January. We're talking about New Year's resolutions, ways to get healthier, stay healthier. One of the common things that we see in the office is this time of year, is people coming in for their annual visits and checkups, and I have a list here of maybe things you want to think about, whether you've had them done yet or not, and making sure they get scheduled to prevent some common things. So we'll start with men first. I recommend, talking, if you're over the age of 40 or 50, or depending on your family history, prostate cancer screening, talking to your physician about whether or not you should be screened for prostate cancer. The next common cancer screening for men I recommend is colorectal cancer screening. That typically begins around the age 50, but unless you have some family history or some other circumstances.
So can I ask, what's the difference in the screening between those two things?
So it's a great question. So prostate is a gland in your kind of genitourinary system, and the colon is how our body processes food in our digestive tract. Colon cancer screening, I like to talk to my patients about, I think is one of the best cancer screening modalities we have, because we understand that how it works. It goes from normal tissue in your colon to a polyp or some abnormal tissue to then a precancerous polyp, then ultimately to a cancerous growth. And when you have a colonoscopy, it examines the whole colon. You're prescribed a regimen of a laxative to help clean out your system, which is what a lot of people don't like about it. And you have to kind of stay on a clear diet for a couple days. But after you evacuate your bowels, and you have to do that so the bowels are clean, right?
Yeah. So that's like one of the most important things that we like to stress too, is how unpleasant it is. It actually increases the quality of the exam and the usefulness of the information that can be gathered from it.
And so when the gastroenterologist or the surgeon, whoever's doing the exam, goes through and looks through the whole colon, if it's normal, they know with high degree of certainty when to repeat the next colonoscopy based on your family history and other risk factors. Or if they find something, it's diagnostic that something's there, and it's also therapeutic because they take it out and they study it. And then it prevents it from growing or becoming anything else depending on what they see. And then it changes your interval when you have your next one. So there should be no surprises. It's great. So if you kind of get on a regular system, it's really high likely that you're not going to develop colon cancer. The same great understanding of a cancer process is the Pap smear for women, which protects against cervical cancer screening. We know that the cervical tissue in women goes from a normal tissue to a slowly abnormal, and then a precancerous, and then cancer. So by
we
women,
know it takes about 10 years for it to start as abnormal to develop to a cervical cancer as well.
Yep.
Which has dictated the kind of new guidelines in terms of screening.
Yeah. So they're the gold standard, I think, of cancer screening tests. And then you move into, so prostate cancer screening is done via, a couple different ways. The most common way is either in combination with a rectal exam where it feels, the man's prostate, and also a blood test called the PSA. And it's a bit more complicated than tonight's show to kind of get into all the nuances of that, but your doctor can explain the pros and cons and benefits of it. The next in line in terms of cancer screening is actually lung cancer screening. There's data now that people who have smoked for what they call a 30-pack year history, so depending 1 pack of cigarette a day for 30 years, or maybe you've smoked 2 packs of cigarette for 15 years, and you're over the age of 55, that a series of low-dose CAT scans of your lungs can help identify early lung cancer. We can't prevent the lung cancer. It's not like a colonoscopy or a Pap smear where there's a precancerous lesion, but if caught early, lung cancer is curable. They remove it. We have excellent thoracic surgeons in our organization, and it's potentially curable.
And we offer, when we have a lung screening program that we've had going on now for almost 2 years, since March of 2015, and we've had hundreds of patients come through, over 200 that we're still monitoring.
Yes.
We found half dozen cases of cancer in those patients, and of those, I believe it was 7 patients that we found, 6 of them have opted for surgery and are now doing great. The other went for a different means of treatment for it, but it just shows that these people who have high risk histories, that there is hope, and to that point, I've heard from someone who's been through the program that they came out with a clean bill of health, which was a huge burden lifted off of them because they had a long smoking history and they assumed that they had lung cancer, had already kind of reserved the fact that it was true, and to find out that they were actually healthy was very uplifting for them. So good news, bad news, it ultimately will be good for you in the long run to do that.
And it's for people who are currently smoking and also people who have quit smoking within the past 15 years. So you should talk to your doctor about whether or not you qualify for it. And we have a great lung cancer screening clinic here at Southcoast.
And I think that's another important point too, is that there's risks and benefits to all of these screening measures, and that it really is a conversation that based on your own risk and your own history and your own family history, and kind of your own comfort level too, that you should be having with your primary care provider in choosing what to pursue and when to pursue it.
Breast cancer screening, of course, for women, I recommend, and I both recommend, for women, depending on your family history, your own personal risk factors, what age to start that, somewhere between 40 and 50. Typically, and that is, we have a great, kind of breast imaging centers here at Southcoast. We offer 3D mammograms, and so that can be either done annually or every other year, depending on the patient and the scenario as well. Some kind of moving beyond the cancer screening into heart, cardiovascular risk. Because if you look at what kills us in this country, what do we pass away from? Actually, cancer just took over the lead spot from heart disease in Massachusetts. So cancer is the leading cause of death. Cancers that cause the most deaths: lung cancer, colon cancer, prostate cancer. And in it, I forgot to mention from a cancer screening standpoint, we also recommend seeing a dermatologist for a routine skin exam, skin cancer screening to my patients. Heart disease, kind of right up there with what causes people to pass away. So, number one risk factor for heart disease, number is smoking. So we try to encourage people, if you're smoking and you're trying to change and improve your life, start with smoking. Reduces your risk of heart disease by about 40% by quitting. And there are some great medicines out there to help make it easier, and nicotine replacement therapy. So, and beyond that, getting your blood pressure checked. We've talked about that. So. Blood pressure, unfortunately, is one of those silent killers that people may not know what their blood pressure is when they're walking around. So whether you have a doctor or not, getting your blood pressure checked, or if you're at the grocery store and you don't have your doctor, just stop by, put your arm in one of the cuffs, get it checked to see. Dr. Rocha is having his his wellness kind of meetings and events that he does. Get your blood pressure checked. Other things that we look at is checking to make sure your cholesterol is okay, because certainly that's very low symptoms in terms of whether your cholesterol is elevated or not, and that's done via a simple blood test, usually done on an empty stomach to see what your cholesterol is, and that's can put you at a higher risk for heart disease. Other things we like to look at that you may not know that are happening, as we talked about in the show before, is diabetes screening, to make sure that if you are over the age of 40 and you're a little bit overweight, you should probably be screened for diabetes to make sure that you don't have some underlying elevated glucose that you don't know of. So that can be done through a blood test. EKG is another simple test that we do in the office, which is an electrical tracing of the heart to make sure that the heart is beating normally, to make sure that, God forbid, there wasn't any sign of a prior heart attack that you can see, to make sure that the sign isn't any signs or symptoms of an enlarged heart. We can routinely do. You can ask your doctor or nurse practitioner to do for you to gain some information. Another reason why we try to encourage patients to get EKGs too, even when they're feeling well, is you get a baseline of what your heart looks like before you're having symptoms. So then if you go present to the emergency department or you present somewhere else and you're having chest pain, so oftentimes our patients call in and write in that there's something to compare to when they're well. So many of our patients ask about whether they should have a stress test or not, and that's something a bit more nuanced, but you can talk to your doctor about whether you have risk factors that should be, whether set up for an exercise treadmill test, or see a cardiologist for that as well, to kind of predicting any unknown heart disease. You looked at your phone. Is there a question there?
Yeah, we actually have a specific question from Judy. Best treatment for a sty?
Hot compress.
Hot compresses.
Yes. Yeah. Super common aggravating complaint that people see.
Yeah. And there are some other iterations too. So a sty is generally smaller, but there's a couple other kind of eyelid complaints, and generally first line hot compresses. Certainly after a couple of weeks of that therapy, if it doesn't go away, we sometimes recommend seeing an eye doctor that they can actually sometimes remove the growth or inject some steroid into it to make it a bit more comfortable.
Yeah. So just a terry cloth washcloth, warm water, not super hot. You place it on the eye, and we often tell them to massage it gently, and it actually works relatively quickly which is nice because certainly in internal medicine, like I don't cure a lot of things, we manage a lot of things, so it's really nice to be able to take something away from someone pretty quickly and really assist them.
So the other question, I want to put you on the spot a little bit. It came through the anonymous. It was someone who had asked a question earlier. I'm not sure if they're comfortable with me sharing their identity because they did it through the anonymous. So I will keep the details quiet. But so I'll kind of ask the question generally. If you have gone to a doctor and they have given you a diagnosis on an issue, and you're not satisfied, you don't agree with it, or you tried it and it's just not working. What do you recommend to that patient? Is it, do they go back again to that doctor and push, or do they see someone new? What's your general guidance in that situation?
I think you have the right to, if you're not feeling well, to seek answers until you're comfortable with what your diagnosis is, so depending on your relationship with your, whoever the clinician was, hopefully you have a good enough relationship where you can go back and say, yeah, something's not right, or I don't feel well, or I'm not getting better. Or if you saw a specialist and you went back to your primary and said, you can have the same thing, go back to the same specialist. But then that's why we have second opinions. In terms of getting another set of eyes on the problem is often not a bad thing to look at. So.
In medicine in general is it's an imperfect science, and it's never, I would caution to say, never black and white. So listening to yourself, bringing up the issues to your provider, and always questioning, advocating for your own health. And if you feel uncomfortable and want to seek another opinion, I don't think anybody would fault you for that.
And if a doctor gives you a diagnosis that you might not agree with and is kind of adamant to stick with that, it doesn't mean that the doctor isn't listening to you or doesn't care what you're saying.
No. I mean, I see this, talk about I diagnose patients with high blood pressure or diabetes, and it's hard to hear, and people get mad. People who get diagnosed with cancer often leave. They get mad at the oncologist. I have colleagues in the oncology world, when they give the diagnosis, the people get mad at them, walk out, don't come back. And so I had several instances where a patient came to me and said, my last doctor, said I was diabetic and I'm not, and that's why I came to you, and I did blood work, and I have to tell them, unfortunately, you are diabetic. So we need to do some things. Maybe we can talk about different treatments. But no, I think, unfortunately, sometimes, the doctor may or may not be right, and it may be, but also maybe there can be things of the wrong diagnosis as well. So getting to that point of comfort is really important, into moving forward and like the next steps of managing whatever symptoms you're having or whatever's driving it. Yeah.
That's great. Well, that's all the questions we have for this week. I think that we're pretty close to the hour mark, so I don't know if anyone has anything to add before we.
Good luck with your New Year's resolutions.
Absolutely. Yes, and thank you everyone for tuning in. If you have any other further questions or topics that you'd like us to talk about on the show, please send them in. We will review them and look at that. Regarding the functional medicine question, we'll try to look into that. I wasn't sure if there was follow-up on that. We can certainly add that. If you know someone who would like the show, please feel free to pass it on. If you could be so good to kind of share the show on Facebook, we'd really appreciate that as well. And again, good luck with all your resolutions. Stay healthy, and we'll see you next week.